Good morning. Welcome to News from the Roots on Mountain Stream TV. Today is Monday, February 19th, 2018. I'm Avram Friedman. Today we have back as a guest Annie Butzner. Welcome back, Annie.
Thank you.
And we're going to talk a little bit about the work that you're doing. Mostly we're going to be focusing on nursing homes and the rights of individuals in nursing homes,
Yes,
as I understand it. So, what you've been up to?
I've been up to a bunch of stuff, but at the core of everything I do, civil rights, and of course voting is the connector to everything. So that's what I care most about. I first became interested in institutional and healthcare facility voting as I was a nurse and noticed that nobody had control over anything. And I always thought that if people voted, then they would be able to express concern for themselves, their family, and community. Well, then I moved to North Carolina. And when I went to the Board of Elections to see how I could help in healthcare facilities, I found out that I couldn't unless I was hired in Buncombe County by the county to become what's known as a multi-partisan assistant team member who, on request only, goes out to healthcare facilities to help vote. The thing that really got me started was when I asked, well, how's that system working out? I found out that there's no evaluation system for it statewide. I visit facilities because I like the residents and I'm interested in that. And in that process, I just learn all kinds of things that keep them from voting, besides the obvious things that you have to know about the Board of Election system called multi-partisan assistance teams, which is not an advertised system. It's not on the County Board of Election sites. Indiana, don't laugh, is my model state for how to help people in healthcare facilities.
And how does that differ from what we have?
They call theirs traveling teams. And each county board of elections has a voting rights advocate who not only calls healthcare facilities to schedule visits, and sometimes it takes 3 visits to get everybody registered to vote who wants to, but they also have teams that go out in the community to help homebound people, which is very important in North Carolina now that you need 2 signatures on an absentee ballot. And if you're a couple and both of you are ill, your ballot's thrown out. In 2016, I believe in Buncombe County, we threw out 76 ballots because they didn't have the 2 necessary witness signatures.
From nursing home residents.
Also out in the community. In the nursing home, you can get anybody except an employee to sign it.
So let me make sure I understand what you're saying. If you're not a member of this commission, you're not allowed to go and visit nursing homes?
You can register voters and help them apply for absentee ballots, but you cannot help with the ballot itself. So either the teams will come out and help you with register and absentee, but I have drives to do that too. They do not come back to help with the ballot unless a second request is made to the Board of Elections for the workers to come out and help residents with the ballot. And once the ballot is completed, these workers are not authorized to carry the ballot back to the Board of Elections. So therefore, the person who is helped either has to hand carry it himself, or an approved family member has to do it, or they're stuck with $1 worth of postage to mail it.
Okay, but and this commission, that's the only issue that this commission deals with, is the ability of nursing care residents to vote using absentee ballot, or are there other functions of the members of this commission in terms of oversight of nursing homes?
No, this is when the monster bill was written. This was written hastily, and it's General Statute 163, Section 3. And when the monster bill was overturned, this wasn't. This is a really legislative oversight that's carried out in each county. For healthcare facilities, special rules were written, and the special rules for voting in healthcare facilities were the same rules that were written for prisons. And the North Carolina has no formal definition of a healthcare facility. On top of this all, if a neighbor or a friend helps a resident or someone else who is living in a healthcare facility or visiting in a healthcare facility to vote, it is a felony charge in North Carolina. So the person helping somebody to vote, if they're not from the Board of Elections or a family member helping with the ballot, is open to lose their voting rights with the felony charge.
Wow. So
it's fear-mongering. There's never been a prosecution.
Does the healthcare facility, does the administration of a nursing home, for instance, have any responsibility to make sure that the residents get an absentee ballot?
None whatsoever, and I've suggested in giving testimony twice to the State Board of Elections that every time a healthcare facility license is renewed, there needs to be an affirmative statement signed by the administrator about voting rights. I cannot even get voting rights incorporated into patient rights.
So again, the administrator of these facilities have no responsibility in even informing its residents that an election is taking place.
No, and when I was sort of a neophyte at this, I wrote to 12 different CEOs or administrators in the Buncombe County area to inform them about this process, and I had absolutely no response from anybody. The people who are experts in healthcare, patients and residents, are prevented from voting in North Carolina, and perhaps it's suppression to decrease their political influence.
Say that again.
The real experts on healthcare are people receiving healthcare. In healthcare facility, you have patients and residents.
Okay.
They're experiencing the good things and lots of bad things about the healthcare system. So they should be able to develop political clout to influence healthcare legislation such as Medicaid expansion.
Right.
But this is suppression to prevent that. We have, I believe, 1,200 adult care homes, some with multiple buildings, and 3,600 nursing homes in North Carolina. We have about 1.7 million people over 65 in the state.
Over 65, and how many of those people are in nursing homes?
I don't know. The number I got for Buncombe County was 18%. I don't know how reliable.
18% of the people who are over 65 are in nursing homes.
Well, actually, 18% of the county lives in some sort of healthcare facility because that includes continuing care.
18% of the population lives in a healthcare facility?
That's my data. I never could verify the data with the author of that data. It was in an economic report.
That seems like an enormous percent of the population living in some kind of healthcare.
I know.
That includes mental health clinics and things.
Yes, but it also includes Deerfield, Gibbons Estates.
I see.
And
retirement communities.
Yes.
Okay, not necessarily healthcare facilities as such. Some of them are assisted living.
Assisted living is considered a healthcare
Is it?
facility.
Okay. Okay. Wow.
And even if that's not an accurate statistic, just think how it's going to grow in the upcoming years.
Assuming people can afford it. I can't. There's a lot of people who probably can't afford it. I had when after my mother had a stroke when she was 86 years old. She lived with me for about a year and a half, and then it just became impossible to take care of her by myself, and so because she kept falling, and I just couldn't be there all the time, and so she ended up in a nursing home facility. But fortunately, she had some resources. She had made some investments, and that actually amounted to over $200,000, which was to her a huge sum of money, and which is a large sum of money, and that allowed her to stay in a nursing home for several years, first assisted living and then a nursing home. But the cost was just enormous. I mean, it drained her life savings in no time. And how can, what happens to people who just cannot afford that?
Well, assisted living, that's the same thing as adult care homes.
Yeah.
And health care is very expensive, and I always suspect that organized crime might be involved in these big chains.
Yeah.
Because so what happens is adult care facilities are the trend in Europe and in California because they're less expensive. They're not at a skilled level. Medicaid will pay for your living expenses there and for your medications and give you about $30 a month to spend. Now, I was interested in the nursing home, adult care home link last week. I went to a nursing home that also has adult care home patients in it. And if you're admitted as a private pay, assisted living, adult care home patient, the cost is, of course, much less. It's half of being in the nursing home.
Right.
And in this particular facility, if you become sicker, you get to stay exactly where you are and receive the exact same services as skilled nursing does, probably because the regulations were too difficult to deal with. If you run out of funds, then you do go into a Medicaid bed. But the Medicaid beds in this nursing home for assisted living are treated just like the nursing home residents. Of course, staff, there's basically, no staffing regulation in North Carolina, and the federal laws don't communicate very well with the state laws. So for a CNA, you only need in a nursing home 1 CNA per floor.
Mm. Yeah, I remember, again, when my mother was in the assisted living facility, I think the cost was $3,000, $3,500 a month, I believe. And then once she was transferred to a nursing home, it shot up to over $6,000 a month, and she was forced to share a room, and I remember the conditions being horrible. I mean,
they probably were.
Yeah, I looked around. I mean, to every nursing home facility in the area, and it was a matter of which was the least horrible.
Well, the move is to go to assisted living and adult care homes because it's less expensive.
Yeah.
So in order to promote that, the regulations that would improve the quality of care in those facilities have disappeared. Yeah. And what's going to happen is we're going to have for-profit adult care homes and assisted living filling up with patients who are really sicker than should be there. And because those facilities get to self-report violations after they fix them, there's no public accountability of what's going on. Now, one thing that really I tried to advocate for, I'm not having much luck. I was in an adult care home and found that med techs with 5 to 18 hours of education are administering morphine to hospice patients. It's less expensive to have a hospice patient in assisted living or adult care. The way the pharmacy law is written, if a physician writes an order for morphine to be administered and it's in exact doses at exact times, then a med tech can administer that. However, a med tech cannot use judgment.
So what are the reasons they administer morphine?
A pain, you're dying.
Oh, it's just for hospice.
Well,
patients.
other patients get it too. Morphine is like the gold standard for pain. Yeah. And it's not the only opioid that's administered, but you are not, an assisted living facility or adult care home is not required to have a licensed person there in order for this to be going on.
The administrator.
And if you live next door to a hospice and somebody could come over, you know, and help you or adjust medication, that's one story. But if you're up on a mountain and you need a medication adjustment,
Can't get it.
you can't get it. And this is
Unless
all
a doctor comes in and prescribes it, I guess. Right?
or on the phone, but yet that nurse is not allowed to really describe the quality of what's going on with the
The
patient.
doctor has to come and physically and do it.
Somebody, yes,
Yeah.
has to come and assess the patient. And because of this system, it's much less expensive for people to be in assisted living or adult care homes.
Yeah. Another thing that struck me was the quality of the care. I mean, the personnel. There must be just very minimal requirements in North Carolina law, because it seemed to me that some of the people who were working there were unqualified.
They take really a 6-week CNA training training course, but
And they're understaffed. I mean, there's not enough people.
Yeah.
And you could go in any time. And this happened in all the facilities. I moved my mother 3 times because I was so angry at the quality of care she was getting. I'm not going to name the facilities, but each one, they all had the same problems. There were alarm bells going off in the hall all the time, that were just not even, they were ignored. And there were people in the hall talking to each other about, you know, what they did last night with their dates and stuff like that. I mean, it was just horrendous. And meanwhile, there were people screaming for help down the hall. It was something like out of Dante's Inferno.
well, part of that, I've written about who takes care of the caregivers. Yeah. So, I mean, no matter where you are, you kind of become the environment.
Yeah.
And you can't meet people's needs because there are all these needs that have to be met at once. So
they're understaffed.
Yeah, so you go home exhausted, feeling guilty about all the stuff you didn't do that you shouldn't do, and you know, not only you know the next day is going to be worse, but the patient knows the next day is going to be worse. A woman called me up on a Saturday night and described, you know, exactly what was happening. And the bottom line of that was, when Ombudsman went in, was that one CNA for 50 residents was...
And it wasn't always like this. Why is it like this now? I mean, I remember when I was a child, my great-grandmother was in a nursing home the last year that she died. And I remember my mother taking me to visit there. And the atmosphere was much less stressful, and you got the idea that people were being taken care of, you know, when they were in need. You know, why has it gone so downhill?
Carolina Public Press has been doing some wonderful work on this issue, but one of the people who write the regulations, who allow this stuff to go on, are our own legislators. Our own legislators are funded by long-term health care facilities, trade associations, or whatever. So we don't get the regulations written that we need, and the Department of Social Services is not really very responsive to situations that will help the patient.
But isn't it also true that, like in the past, many of these facilities were run by non-profit organizations and charitable organizations and churches, and today that's been transferred over to for-profit organizations that perhaps are trying to get by with as little as possible in terms of hiring personnel. And in other words, before the motive wasn't making money, the motive was taking care of the people. And now the motive
is making money.
Is
and
making
even
money.
I worked for a nonprofit chain that was terrible. And what happened was the money just went back into salaries.
Mm.
Also, they have ancillary services now that they're also supporting the large chain. So it's just a big mess.
Yeah. And it's only, I guess, unless something dramatic changes, it's going to get worse and worse, because the proportion of the population that's getting older is increasing. With the baby boomers now getting to the age where we're going into assisted living and nursing homes, the proportion of the population is greater because of the baby boomers.
Yeah, this is happening all over the world.
Yeah.
I was recently visiting in Toronto, and I thought that their assisted living adult care system would be better, but it's really not great. It's kind of a neglected population worldwide. And with the voting, I always thought that voting would be the vehicle to get the community to go in and meet the people and realize that people living in these facilities are us. They're just like us. But that has not happened. I myself, on weekends, I eat meals, with residents. I take them clothes and things like that. And, when speaking of this population, often people refer to them as demented, mentally ill, or disabled. Well, they're people first. And the biggest part of any person is well. So if you interact with the well part of a person, of course you may see some behavioral changes, but more importantly, they'll be happy.
But, the world has changed so much in the last 50 or 75 years. Prior to that, there were extended families, or tribes, you might say, and the whole village helped with child care and with adult care, and that's how this situation was managed. There was a community that took care of the elderly.
My Aunt Jane Jacobs felt that we just started to fall apart with the advent of being so mobile with the automobile. That was her number one reason.
Well, yes. Isn't that true? That's right. Families have been torn apart by the type of economy we have, in which people move to, because there's employment in another part of the country, in their field of interest or whatever, and the whole fabric of extended family and tribalism has been torn apart. And it's just in the last 50 or 75 years that we've engaged in this social experiment, really, of depending on corporate America and different organizations and the government to take care of the needs that a family used to take care of.
Well, my aunt addressed this in a book in 2000 called Dark Age Ahead, and she actually identifies four core problems we have that you wouldn't recognize. And the first one is the mobility with the automobile. Other ones are the inability of the professions to police themselves.
Yeah. So, if you were to think of a solution in an ideal world, how would we deal with this in a more comprehensive and humane way?
Well, I just had a wonderful experience in Toronto with my family. Jane's family, they stay at home a lot. And they use a regular phone and watch TV rarely. So it's a whole different, but that's not practical for most, for most people. A lot of stuff goes back to being local.
Yeah. So, but I mean, is there a way we can organize ourselves to deal with this crisis? And it's becoming more and more of a crisis, and so that it can be dealt with economically and viably. Because it seems to me that the current system is a failure.
It is.
Yeah, I mean, there's a lot of pain involved, especially for the elderly people. There's a lot of loneliness. There's a lot of time spent without any social interaction.
I have my plan. I have a friend who was ex-deputy director of the 4 branches of the CIA, but he was a hospice director for 10 years following that, and he knows systems. So this is the system that we designed. In the community, there would be residents where there are people who need a lot of help. However, the citizens taking care of those residents would be people from the community. And in the care team with the physician and a public health nurse, not a private nurse, and physical therapist and whatever, the community members and family would be included, get rid of HIPAA. And then in turn for participating in something like that, when you get old, you would have a place that you were familiar with and a place to go.
It's interesting. My son is actually, do you know my son, Zev? Well, anyway, he teaches permaculture design, and he's expanded. It's not him that's expanded, but the term permaculture has expanded to incorporate all aspects of life. In other words, designing living systems so that it takes care of all people's basic needs, and in a way that's more based on cooperative interaction than in simply paying somebody to do it. And he's tapped into a concept which is actually not new. It's something that was used, has been used throughout the ages, and most recently notable, like in the era of Reconstruction, black communities developed around this idea of a mutual aid society. Are you familiar with that concept? And it's basically, you get together. It's not necessarily people who are living right next to each other. It could be a broad population of people within a region that then everybody doesn't have to know each other or anything, but and forming, like a credit union would be an example of one part of a mutual aid society. And a healthcare system would be another aspect of it. And so everybody contributes toward these various necessary organs of the society: child care, elderly care, banking, healthcare in general, and contributes toward these things either monetarily or by putting time and volunteer time into these different things, and creating this network within the community that is designed to take care of everybody's basic needs on a more community level, so that every person doesn't feel alone in their endeavor to survive in life. That it's a system in which everybody's helping everybody else in the community to survive, rather than competing against everybody else to survive.
There's actually, I guess it's a town now outside of Fredericksburg, Virginia, that population is mostly of color. It started in Reconstruction,
right.
and that's what it's like.
That's what I think the example he uses, and saying it still exists. Apparently, and that's not the only one. There are several of these black African American mutual aid societies, which is what they call them, that still exist, and they don't get a lot of publicity, but they work.
Yeah, I didn't know about this one until, and when my family, there's a tradition at all holidays to have a Smithfield ham. Well, when Smithfield was bought by a Chinese company, that went out the window.
Right.
So it meant that our family all over had to find a new source of, hams. And someone told my aunt about this little community. So, for instance, for Christmas in Toronto, I ate a ham purchased from that community.
Okay.
Yeah.
Yeah. So, it seems to me that this is the level that we have to start thinking about if we really want to survive without a lot of misery in the coming decades, with such a large percentage of the population reaching the age where we're going to have to do something or depend or suffer in nursing homes and assisted living places with inadequate care. And the expense, again, the expense, there's so many more people that can't afford that than can afford.
There are some programs, Robert Wood Johnson, and the PACE program is to keep people, in their home with support systems.
Mm-hmm.
But access to that is not always known. And for me, I've learned so much from people in this population. It's just incredible.
Well, they do. I mean, that's true. I mean, elderly people have a certain accumulated knowledge and wisdom and, that is not valued in the current political and economic system that we live in. It's kind of like we live in this disposable society. We throw out things when they get old instead of repairing them or using or trying to find the value that's left in them. And I think at one time, throughout most of the history of the human race, the elders were held in high esteem because of their experience and knowledge. And that's just not the case anymore.
In my voting work, I became acquainted with someone who was 101. Her name was Kay Brown. She's since died. But Kay, she saw her perspective was so basic and practical and funny, actually funny at times. She used to write testimony for me when I was talking to people about the voting rights of elderly. And just for instance, with the ID law, she wrote a letter that said basically, we haven't been anywhere, we're not going anywhere, politicians wake up.
Yeah. I think maybe there ought to be a group of people, even if it's hired by the state, that goes around and just transcribes what people have to say when they're older.
And, well, it's not only to when they're older. For instance, the city I live in recently had a transit survey. Well, it was hard to do. It was on a computer. It's full of yes and no questions. When I just decided to go out. I got a simplified form of it, and I went out and talked to people. And what they said was critical, and yet it wasn't captured, in the survey. It was so I did 125. I have stories of 125 people in transportation.
Can you relate some of those stories?
Sure. There's ABCCM in Candler has they have a facility there for all kinds of things. And one of the things they collect there are all kinds of clothes. I go there frequently because I get clothes for adult care homes. And I asked the gentleman who's there every day if he would do his transit survey with me. He's elderly. This is an elderly gentleman who takes the bus from wherever he lives in Asheville to the DMV building on Patton Avenue, Smoky Park Highway, and then walks 5 miles every day.
How old is this man?
Probably 80.
He walks 5 miles
and then walks back every day. That's how important it is.
10 miles he
walks?
Walks?
And this is ridiculous. There are disabled apartment buildings where one building, even built with the bus turnaround that's not used, where the residents have to walk 1.5 miles without sidewalks or curbs to get to a bus stop. You know, and it's not just indigenous to our city, but we certainly need to do more in transportation, rural transportation in western North Carolina. Kind of work on that too.
Yeah, here in Silva, there's no, well, we have the Jackson County transit system, but it's very, very limited. And it basically just goes between Dillsboro and the college campus half a day. You know.
Well, in Buncombe County, I was in a country store way out on a mountain, and, well, there was sort of like a holdup in the store, to make a long story short. But, you know, the people who did the holdup, you know, were people using drugs. They have nothing to do. It's a lack of opportunity, I think, because there's no transportation. So you see exactly the same kinds of problems that you see in the city, because it's the same issue. Lack of opportunity without transportation.
Sure. And communication. I mean, unless somebody can afford a landline, you know, that's, you know, they don't give you a phone in these facilities. If you want a telephone, you got to pay for it, and you know, it's an expense that many people just simply can't afford. You know, so they're isolated.
That's exactly right, and it's depressing. And the more you become isolated, the more isolated you become.
Yeah.
And it's even in the finest long-term. The most expensive long-term facilities.
Yeah. So you know, I can see two directions. I can see things going in the direction that I was talking about earlier, where people start getting together as extended families and communities again, and helping to take care of the elderly. The other possibility is the science fiction one, where we begin to use robots to take care of people, which is actually happening in some parts of the world. There are actually Android-type robots that are now being built in Japan, and they've come into the realm of economic possibility, and they're being trained, or they're being programmed to take care of the elderly. And I think to myself, you know, maybe that's not such a bad idea if the other thing isn't going to happen, because a robot isn't going to ignore an alarm bell. and it'll probably be cheaper to operate a robot than it would be to hire somebody who's not qualified anyway to do that work and pay them minimum wage, you know, and they can be on duty 24 hours a day. But
isn't that interesting? That's happening in a culture that never even had nursing homes.
Right.
It's because they've become so mobile.
Oh, in Japan, you mean?
Yeah. Mm-hmm.
Yes.
They never had nursing homes, nor in Korea.
Yeah, because they used that extended family. Everybody did. Here in the United States, they did too. You know, before 1950. You know, that was the norm. Is that people lived. You know, I don't know. What the history of your family is, but mine, I imagine yours was pretty similar. I lived in the South Bronx, or I was born in the South Bronx, and my entire extended family of immigrant parents and uncles and aunts and cousins lived within a 4-block radius of each other in the South Bronx. And I always had family until I was about 5 years old. I always had family. I mean, we were always gathering for meals together, and we were helping. You know, they helped each other with childcare and everything else. You know, then about 1955, everything changed. Everybody moved out of the South Bronx. Some went to California. Some went to Houston, Texas. Some went to New Jersey. We moved across the bridge to Whitestone in Flushing, you know, and some people went to Florida, and the family just exploded, and suddenly we were on our own, you know, and it all changed.
Mine moved to Canada.
And
They're
yours
all moved to Canada.
to the same place in Canada? Oh, okay. Well, that's interesting.
They're from coast to coast in Canada.
Yeah. So it's basically the same thing, but it all changed very suddenly. And as you say, I think it was because after World War II, suddenly everybody could afford to buy an automobile. The airline industry came into prominence, and so you just bought a ticket and you went somewhere, anywhere in the country or in the world, and that access and just the economy changed also. It became more corporatized, less localized, and so job opportunities forced people to seek economic opportunities away from their local community, and that's what happened.
Jane Jacobs wrote a book about that too, called "The Nature of Economies."
Yeah.
Because eco means biology.
Yeah. So, and again, this is just an experiment, and I think it's failing. I think it's failing because at least in terms of humanity, it's failing because basic human needs are not being met. Just the basic needs of how we socialize, and having those strong psychological connections to other family members and just that tight, now it's like you and your nuclear family against the world,
Mm-hmm.
And it was never like that before, and it's I think unnatural is the way I'd have to put it, or if it's natural, it's just a whole new realm that humanity is going into, that we have no practice at.
No model.
No, there's no model. That's right. We're just kind of winging it as we go, and it's failing because, I think that's what's at the root of the cause of all the violence in our society, all the frustration, people feeling alone, all the shootings, and the gun violence and such. Yes, there are too many guns out there, but that's not the whole problem. The bigger problem is that why do people feel the need to strike out like that?
In western North Carolina, this is my story, and of course Shelton Laurel in the Civil War, where so many young men were killed and buried in a mass grave in Madison County. And I always think that it's such a violent, I used to teach students from there, that has something to do with the fact, the tradition of an angry community. And there's a lot of violence in that community, and drug use, alcoholism.
Well, and that's become so prominent for you. We keep on hearing more and more about the opioid crisis. Why are people so frustrated? Well, what's at the core of all of that? Why are people striking out in such a violent way? Why are people having these deep psychological problems? Why is there so much stress on a daily basis in everybody's life? I mean, I don't know. I don't think I know anybody who isn't stressed out economically right now, and just feeling the pressure of even if you're not under extreme economic pressure yourself, you're feeling it from all around you, of everybody else who is. And it's manifesting itself in so many different ways, such as shootings,
maladaptive behaviors,
such as disease. And when your body gets stressed out, you become more susceptible to the flu. I mean, it's all connected, and then you let somebody like Donald Trump be president. Yeah. Yeah.
Well, I've discussed this question with several people. Enrique's one of them, and my cousin Jimmy in Toronto is another. And they have different reasons for this constant. But my cousin Jimmy says the bottom reason is boredom. People have to be engaged in something.
And now we're all engaged in our cell phone screens, mostly. You know, and again, it's a feedback loop of violence and sex and and stress. It's one. If you're watching a news report, the first thing they report on is the murder that took place today someplace. And just a lot of fear and stress. It's like Michael. Did you watch Bowling for Columbine by Michael Moore?
Yeah.
And which he talks about this too. It's like in Canada, there are just as many guns per capita as there are in the United States, but I think there were like 7 murders throughout all of Canada last year, and that's takes about 10 minutes in the United States.
It's just the whole environment is different there. Walking down the street is different.
Well, it is.
You see all kinds of people doing all kinds of things.
But he points to the news report, the difference between how the news is reported in Canada and it's reported in the United States. And the United States, if you look at any news report on any of the networks, fear and violence, fear and violence, fear and violence, fear and violence. It's just drummed into us, on a daily basis. And then same thing with the headlines of the newspapers. It's much. If you go to Canada or any European country and watch a news report, it's much more in depth and they talk about issues that are important. It's not just gun. Well, there's not a lot of gun violence to talk about in Canada.
Well, I think in America, I can see this in myself. When I'm in America, I think about American things. When I'm in Canada, I think about the rest of the world.
Yeah.
But my attention is so captured here in America. It's very limited, self-reinforcing.
So, do you have any other stories that jump out and tell the story of the plight of people who are living in nursing homes and assisted living facilities
Well, yes, I do.
How their rights are being violated?
I had the opportunity to provide public comment and testimony 2 weeks ago in Raleigh at the Federal Commission hearings for civil rights. It's a 60-year-old commission, and it does a report. There's a report every year. I had the opportunity to hear all kinds of wonderful people about civil rights and people who were not enlightened about civil rights. And somebody spoke from disability rights, and the person who spoke from disability rights had all kinds of fine statistics about what's happening, numbers for some kinds of the things that I'm doing, yet it gives you no picture of what's happening, what's really happening. It's boring when you present it.
So let's hear what you got.
So what do I think should happen?
No, I'm saying, can you relate to us some more of the
Commission?
The stories, whatever you have, this. Yeah.
This panel discussion, one person that was included was, of course, Dr. Barbara, Anita Hills from the Southern Poverty League, and Gwen Eiffel from the NAACP, as well as many other people gave talks or discussed civil rights issues, and not only in their particular state, but all over the country. On the main panel, on the commission itself, there was one gentleman who was on Trump's investigative election committee or whatever, that's defunct now. And Dr. Barber just took care of him right away. Right away. when I gave public comment, it was a first come, first served thing. And you can watch it on YouTube. I'm boring, but if you want a good look at North Carolina and the people who are controlling how we vote in North Carolina, look at that panel. The first person who spoke used to be identified as a well-known North Carolina Tea Party person. A little background on him as so that he could challenge votes in Buncombe County. He spent 2 months sitting in the Register of Deeds office, matching up addresses of people registered to vote with the Register of Deeds addresses, and then he challenged all of those voters at meetings. His strategy at when he gave testimony was to blame Democrats for all the things Republicans do, saying that it was unjust that we had a hearing on a work day, and just gave cases of what he thought were voter fraud, and there were a string of people who supported that. One story that was humorous was a little white van with 3 little old ladies in it who just went around the county and voted everywhere.
And this was a true story?
Of course not.
No.
But people give this testimony and similar.
And what evidence did he have of that?
There's an observation.
Oh, I see.
It was a forum for people to voice their views.
So he just made it up, basically.
I think that a lot of them were made up, yes.
Yeah.
Mm-hmm.
Mm.
And there were a few people who spoke out to increase voting rights.
Yeah.
Like me.
Right.
And what I spoke to, because I wanted it in a public record that was outside of the public record of North Carolina, I addressed the voting rights of citizens in healthcare facilities in North Carolina who were voting by the prison rules. And I went on to illustrate the barriers to voting in a healthcare facility. And I ended up, I guess, pointing out that this was just all fear-mongering for voter suppression.
Yeah. And that seems to be the tactic. I mean, to create this public image. It's kind of like Ronald Reagan did with the welfare queen. This public image that is based on no reality, and therefore create doubt in the public mind and a rationale for things like the voter ID law, for the Republicans to vote for the voter ID law, whereas there may be 1 or 2 actual cases of somebody voting fraudulently. It's disenfranchising hundreds of thousands of people from voting.
The confusion too. In 2016, there was an article in the paper about this. A woman who had moved from Maine to West Asheville, and she had gone to get voter ID. She didn't have a car, and she was denied voter ID because one of her credit cards had her middle name on it, and her Maine driver's license, which was still legitimate, did not have it, nor did other documents that she had. I took her back a second time, and she was again denied. And I informed the Department of Motor Vehicles I had spoken with the State Board of Elections, and indeed she was to get a voter ID, and she eventually got one. But somebody knew about me to help her. If I were a person who had to get a ride someplace to vote and I was confused, I sure wouldn't go back again.
So what is the status? So the photo ID law was overturned, but you still need an ID to...
Well, only if you're asked for the first time when you go to the polls, and you can have a utility bill, any kind of check from the government. You don't need a photo ID. However, the League of Women Voters at this conference was addressing the fact that they're afraid that North Carolina is going to try and institute a voter ID.
You mean a photo voter
ID,
again, yeah. If they get the chance to. this election might change things, depending on redistricting rulings that that happened before then. But that, what a mess, huh? In this state.
Well, cheer up, things can only get better.
What was this? Cheer up, things could get worse, and sure enough, they got worse. You know, I hope you're right that things can only get better. But watching the direction of our current president and current General Assembly, they could get worse if we don't stand up and stop them from getting worse. Because these guys seem intent on consolidating their control. They don't believe in democracy. They don't even pretend to believe in democracy. And they are rapidly as they can, consolidating their power in the institutions that would enable them to keep the government in control of a conservative minority, not conservative, but radical right minority that has seized power in this country.
Now it's oozed into our educational system right here in Western North Carolina.
Yeah. The educational system, political system, the economic system. They seem unaware of the fact that if you create poverty around you, that it's going to impact the quality of your life, you know, even if you're not experiencing poverty yourself. And that's what there are so many people experiencing poverty right now. Economic poverty, spiritual poverty, just quality of life poverty. That it's unimaginable how there is a whole class of people that can be blind to that.
Well, you just described living in a healthcare facility.
Yeah.
It's impoverishment on every level.
On every level. That's right. It's worse than poverty. It's anguish. You know,
Suffering.
It is. It's suffering. It's pain, and it's suffering.
Well, I think North Carolina is just going to attempt to regulate us out of voting.
Regulate us
out of voting. Just keep adding so many restrictions that it's impossible to navigate the system for a large part of the population.
Yeah. So it'll be available only to rich white men, basically. Yeah. So what can people do to help you, and if they want to become involved in this issue? Is there an organization, or is there a website, or a Facebook page that they can go to?
No. and there should be. But in your own organization or group, or just on your own, you can organize a call to action in healthcare facilities in your community where you go in and register and help people apply for an absentee ballot. The forms themselves are confusing and they're hard to find. That would be a huge service. The Board of Elections, that's their job to do it, but because of the way the law is written, somebody needs to request their help.
So is Democracy North Carolina involved in this issue at all?
The NAACP civil rights attorneys are getting very interested in what that I'm talking about.
So
and
one thing,
they're looking at me as the.
So one thing our viewers could do is maybe go to the NAACP website, which is naacpnc.org, and look under voting rights issues, and you can contact the NAACP and voice your support for the NAACP getting more involved in this issue.
And I'll contact the president and make sure there's some sort of link.
Dr. Spearman.
Yeah.
Yeah. Annie, thanks so much for coming on again, and we'll have you on again and again to talk more about this issue and to update us on your work, on your great work.
The reason that I think local groups should be doing this is because I have my ideas, but your ideas are probably better and they fit your locality. So that's why.
Well, it's great that
Yeah.
you're being an advocate for these issues, because there aren't many people that are doing that. It's certainly needed. So thank you for your work.
Oh, you're welcome.
Okay.